Hi, this is Dr. Chris here from Square One, and I'm doing the Square One Health Tip of the Week. And today I'm talking about one of the major problems of chronic pain, joint pain, spinal pain, neck, back, low back, all those things. And that is inflammation. Now, a lot of times when we think of inflammation, we think about inflammation as a result of a direct injury. Someone sprains a knee, something like that, and the knee swells up. That's one type of inflammation. But we're talking about more today is chronic low-grade inflammation, which is a little bit different. And there's some different causes of this. Now, this over here talks about some things that lead to different inflammation. And we definitely see things like injury. This can happen due to automobile crashes, sports injuries, different kinds of physical slips and falls, different kinds of injuries. But a lot of those injuries are related to different kinds of mechanical stresses too, which could be like repetitive type injuries, like micro injuries, having bad posture, sitting at computers all day, bending over and being in awkward positions, not getting mobility in your spine. That can create a lot of mechanical stresses and injuries within the body. Infections, obviously, that can cause inflammation. Toxins in the environment. Lack of exercise is a big one. Not moving your body can cause inflammation throughout the body and in the joints. Your body requires exercise. And then we have some things that talks about an imbalance in your immune system, imbalance in immunoglobulins. A lot of that can be caused by leaky gut, which I'm going to talk about a little bit later. It's things that are related to that. And then obviously just things like environmentally, too much radiation from your environment. So these things can cause chronic inflammation in your body. The biggest one I want to focus on today, though, is related to omega-6 and omega-3 fatty acids. These are called essential fatty acids. They're essential because your body cannot make them on their own. You have to get them through consumption. Now, omega-6 fatty acids are basically very pro-inflammatory, and we find these in processed foods. Sugars, grains, like your breads, your pastas, things like that, a lot of baked goods. These are very heavily loaded with omega-6 fatty acids, which are very pro-inflammatory. The average Western diet, American diet, is loaded with these things. What's anti-inflammatory is your omega-6 fatty acids. This is like your fish oils, things like that. Now, we need both of these, but naturally, in nature, for very healthy people, we want about a 1-to-1 ratio, which means for every 1 omega-6 in your body, you'd want 1 omega-3. Through various studies, you can look at most people in America, if you're eating an American-type diet or a Western diet, have anywhere from, for every 1 omega-3, they have 20 to 40 omega-6s, which is huge, creates a lot of inflammatory problems, a lot of health problems I won't go into today. But I want to show you how it actually creates problems with pain. So what happens is when you have extra inflammation in your body, that leads to something called fibrosis. This generally happens in healing of a joint, but it can create a lot of problems. Fibrosis is like basically when your body builds up adhesions and scar tissue within a joint. What happens though when you get fibrous tissues in your joint and you get adhesions in those joints, the joints stop moving properly. It actually causes an increase in stiffness within the joints. Now, this is related to chronic pain because when joints don't move properly or they're injured and damaged, they start to send a signal called nociception. All you have to know, it's a big fancy word, it's a negative pain signal, and when it goes to the part of your brain where you're consciously aware of it, it causes pain. So when joints get inflamed, they build up fibrous tissues called this fibrosis, and that causes stiffness in the joint, and that causes an increase in overall pain within the joints. As a chiropractor, when we're actually adjusting people, we're getting mobility in those joints, we are working on breaking up adhesions and scar tissue and fibrosis, and we're getting mobility into the joint, and that's part of how just by getting mobility in the joint, you decrease the overall pain. But as a chiropractor, I can do everything within my power to get joints functioning properly, but if someone still has a lot of chronic inflammation through diet, they're still going to have problems, chronic pain, and other health problems. So there's where we got to look at some other things outside of what's happening just within the office. I always say being a chiropractic patient, exercising, that's a part-time job. Diet is a full-time job. Now, a part of it just needs to be addressed through proper diet, which I recommend, like the paleo-type diet or Mediterranean diet, anything that's more balanced with the certain kinds of foods. That's for a whole different topic. But I think everyone needs to supplement with high-quality omega-3 fatty acids. And when you're looking at these things, we're talking about fish oils, maybe like cod liver oil. I like fish oil. I think that's what I recommend the most. The biggest thing you're looking at is the amount of EPA and DHA. EPA is eicosapentaenoic acid. and DHA is docosahexaenoic acid. EPA has a lot of pro-inflammatory things in it. DHA is more for brain and nerve function, both highly critical for a chiropractic patient. Now, when you're looking at brands, it's really important to look at how many grams of EPA and DHA are you getting for your dollar? Because there's a lot of brands out there that look very cheap, very cost conservative, but when you look at them, you may need to take 10, 20, 30 servings to get the required amount of EPA DHA that you need. Now, as far as how much do you need, here's some general guidelines. I think the average adult needs about 3,000 grams or 3,000 milligrams or 3 grams of EPA DHA on a regular basis. Body size can make a difference, and so we can do some things according to body size. A child, basically cut it in half. And if you got pets, I say, yeah, definitely give it to them too. We can actually do some simple blood work through finger prick tests in our office, so you can measure how much EPA DHA you have in your body compared to other fatty acids, so you know how much supplementation you need to do or what your levels are like. But those are some general guidelines. Not all fish oil is created equal. You really want to make sure you get a brand that's third-party tested, make sure it's clean and pure, and it has in it what it says it has in it. And then keep in mind, you're looking at how much it's costing you for a gram of EPA and DHA. So some brands may look more expensive, but when you look at it, you may only need 1 or 2 servings to get your daily amount, versus some of the cheaper brands, you may have to get multiple servings to get that same amount. And when I've looked at different brands, it becomes very similar when you're looking at cost per EPA DHA. So if you have any questions, feel free to contact our office. We have ones that we recommend, and we'll show you how you can get discounts on that. But just keep in mind, another really critical part of battling chronic pain is reducing inflammation. And part of that we do with getting mobility in the joints in our office, but a big part has to do with the kind of diet you're eating and getting the proper supplementation and making sure you're consuming your high fatty, your high quality omega-3 fish oils. And that does 2 things. It shuts down the production of excessive inflammation in your body, and the other thing it does, it gives your brain and nervous system the essential nutrients they need to heal as well. I always tell our patients, look, bone is calcium, a muscle is protein, brain and nerve is fat. So this is Dr. Chris from Square One giving you the health tip of the week. If you know anyone in the Fort Collins area that has health problems, aches, pains, neck pain, low back pain, any of those kind of things, just refer them to our office for a free consultation. If you live outside of the Fort Collins area, I would say look for a doctor trained in corrective care. Go to idealspine.com. You can find a doctor within your area, and stay tuned for our next video.